Welcome to another video, guys. In today's video I'm going to be making a comparison between the NHS versus the care home. To a lot of people that want to work in the UK as a nurse, if you want to migrate, one of the questions that a lot of you have is that should I work in the NHS or should I work in the care home or the nursing home? Also, when I was moving to the UK, this was one question that was on my mind, and it's really a big decision to make, but it's not that difficult if you just know what is obtainable in both places. So in this video, I'm going to be making a comparison between both. I'll be explaining to you what the NHS is for those that don't know and what nursing homes are. I'll tell you what is obtainable in both places, and I'll be making comparisons in terms of job satisfaction, your career progression, the salary, other benefits that is available in both places, and hopefully by the end of this video you'll be more equipped with knowledge that will help you to make your decision as to where you want to move to or where you want to work when you move to the UK. So firstly, what is the NHS hospital? So when I'm mentioning NHS in this video, for those of you that don't know, NHS is the UK healthcare system. Okay, it is publicly funded and it is controlled by the government. It is managed by the government. This is where a lot of people go to when they are sick, when they need healthcare, except you have money to afford private. But generally NHS is available to all. It is, funded by public money from the tax that you pay. There are lots of specialties. You have the nurses, you have the doctors, you have a lot of professionals in the NHS working together, under one broad umbrella. And one thing is also that there are NHS hospitals in different cities. You have in London, you have in different parts of the UK. There are NHS hospitals everywhere and it's accessible to all. And you're working in NHS is just like working in any standard hospital in whatever country that you are, okay? It's just like an hospital setting where you have a lot of professionals, and under each profession you have a lot of specialties. Nursing, for example, in NHS you'll find different specialties from oncology to pediatrics to adult nursing to geriatrics to orthopedics, name it, whatever specialty you want is in the NHS. So yeah, for my brief explanation, you imagine that NHS is a very broad umbrella. It is just, when you hear NHS, know that it's just the healthcare system of the UK. Nursing homes, on the other hand, are mostly private and they are considerably smaller when you compare to the NHS. So they are mostly owned by private organizations. And when I speak of nursing homes, it's not really common in Nigeria or other parts of Africa, but in this part of the world, there are lots of nursing homes, and nursing home is a big part of their healthcare system as well. In nursing homes, as a nurse, you will not find a lot of specialty. It's mainly involved in elderly care. You can have some mental health, you can have some learning disability, it's just mainly elderly care in nursing homes. Unlike the NHS, where you find a lot of nursing specialties, the specialties that is available in nursing homes are limited. And you will not find lots of professionals like you find in NHS. Although the nursing home still works hand in hand with the NHS, they refer people to NHS, they consult with people in the NHS, but yeah, it's considerably smaller, and the amount of specialty of nursing that you find in nursing home is limited. There's no opportunity to diversify when it comes to career. So that's just a brief explanation of what a nursing home is and what NHS hospitals are. Now I'm going to dive into the differences between the nursing homes and NHS hospitals. So first of all, let's talk about your skills in nursing homes versus your skills in NHS. One thing a lot of nurses are always concerned about when they want to decide to move to nursing homes is that they feel like they will lose their skills. This is true to an extent, but it's not completely true, and I'm going to explain. In NHS hospitals, yes, definitely you'll be exposed to a lot of conditions, you'll be exposed to a variety of patients, your skills will be challenged, and it depends on the skill that you have. There's also opportunity for you to specialize in other areas of nursing. If you are tired of working in one aspect of nursing and you feel like you want to move on to something else, to another area of nursing, you can always move in the NHS. So yeah, there are opportunities for you to improve your skills, there are opportunities for you to maintain the ones that you currently have. But another thing is that with the NHS also, you have access to other professionals. You have access to senior colleagues. On a shift in the NHS, you can have more than 4 nurses on one shift, depending on how big the ward is. And then you have your managers on ground, you have the heads of department, you have the doctors, you have dietitians, other professionals that you can always consult with. So if you meet something that you're unfamiliar with, you have help, you have people that you can ask. And if it is something that you cannot handle, it is easy for you to refer or to transfer the responsibility to someone else that is better equipped to manage the condition of the particular patient in the NHS. But on the other hand, in the care homes or in the nursing homes, you will not lose your skills. That's why I said it depends on the skill that you have. If you're a pediatric nurse, for example, or if you're an orthopedic nurse, or if you're an ICU nurse or theater nurse, all these specialized areas of nursing, going to the NHS hospitals might be the best for you, because that is where your skills will be best utilized. But if you're an adult nurse and you're passionate about geriatrics, you're passionate about elderly care, or you're a mental health nurse that is passionate about, dementia, learning disability and all that, then your skills will be properly utilized in the nursing homes. So it all depends on the skills you have and where it will be properly utilized. And also in the nursing homes, you are kind of like very, very involved in the patient's care, okay? You make most of the decisions and then you refer. So in nursing homes, you don't really have help. You are in charge of your unit. So you don't have help. Before you even call for the ambulance, before you call for help from NHS, you still have to make some decisions by yourself. And that way you can think critically. You are in charge of managing the units by yourself. So you are used to thinking on your feet. You are used to thinking on your own, not depending on anybody. That is another way that your skills can be built in the nursing home. So it depends on your area of interest and it depends on what skill that you have. Let's now compare the NHS versus nursing homes in terms of career progression. Everybody wants to progress in their career, definitely. You want to move across level, you want to become managers, you want to become heads of your units. Yeah, that is perfectly fine. So I'm just going to give you a brief explanation of what is obtainable when it comes to career progression. In the NHS, there are bands, okay? Bands are like levels, and you move up in level, which depends on a lot of things, your years of experience, your education. All those factors come together to determine you moving up the band. And typically, if you're an overseas nurse that is coming from Nigeria or any other part of the world, you'll be placed on band 5, most likely. Yeah, that is what I've seen that is common. You'll be placed on band 5. From band 5, you can always move up the levels, band 6, band 7, band 8, according to how long you spent on the job, or if you've had other additional qualification, or if you've gone back to school, or if you specialized, okay? So all those things account for moving up the level. So career progression in NHS is kind of automatic, as long as you have all the requirements, for you to move up the ladder. So in nursing homes, okay, career progression is not automatic like the NHS. There are a lot of things that are involved, and it's also subject to availability of that open slot in your company. Everybody employed into the nursing homes are employed as registered nurses, and all the registered nurses are on the same level mostly. And then you can have the opportunity to move to the level of a unit manager if you have the necessary qualifications, after spending some time in the nursing home, and eventually at the top of the ladder, the home manager, the regional manager, and so on and so forth. But progression to this career is not automatic. A lot of people are in nursing homes and they are just registered nurses for a long period of time, and they are happy with it because the pay is good. So it's not automatic, okay? Yeah, but it's possible. You can always move as long as you have all the qualification. But unlike the NHS, there is no band level in the nursing homes. There's no automatic band level. Once you're employed as a registered nurse, moving up the ladder is subject to a lot of things. First of all, availability of the job. If you want to move to the level of a unit manager and you already have a unit manager in that position, they will not promote you automatically. That space has to be vacant, and when you see it's vacant, then you now apply for the job all over again, okay, or apply to be promoted. Finally, let's talk about the salary in the NHS versus care homes, and then we'll also be talking about other benefits that are obtainable in both places. Generally, I will tell you now that salary in the NHS for nurses are considerably lower than salary in the nursing homes for nurses. But that doesn't mean you should go to the nursing homes, because there are other benefits that are obtainable in the NHS. So it depends on your own personal situation and personal circumstances, see. So benefits that you can obtain in the NHS that you can't obtain in the nursing homes are benefits like your maternity pay, your payment for sick leave, pay rise for working nights, for working weekends, for working at other hours apart from your shifts. Most especially the pension. The pension in NHS is heavy, is considerably higher, because NHS contributes more to your pension and you get paid very well upon retirement. So if you're still confused about the NHS versus the care homes where you want to go to, that is perfectly fine. That is perfectly okay. A lot of people are confused until they get here before they realize what they really want. Especially now that job opportunities are scarce, they're not as available like before. Anyone you get, my advice for you will be like, take it first, okay? You can, if you get an NHS job, take it. If you get a nursing home job, take it first, and then come here. Then when you come here, you can experience that. And if you don't like it, if you're not satisfied with it, you can always switch. You can always move to wherever you feel comfortable with. A lot of people come here on NHS jobs and they see that it's not for them and they end up switching to another employer in care homes. So don't be picky, just choose one, come here first, and then you can decide which one is best for you. You'll be surprised that even after working in NHS and you decide to move to nursing home, you see that, oh, you actually like the nursing home better than the NHS, and you end up moving back. So you can always experiment when you come here, but get the job offer first. Wish you guys success in all your endeavors, and as always, don't forget to like this video, don't forget to subscribe to my channel, and drop your comments in the comment sections. Drop your questions and I'll try as much as possible to answer them, or do a video dedicated to those sections. And I'll see you guys in my next video. Bye.